I'm Kevin Sullivan, and I lead Pfizer Specialty Care, a group that is boldly tackling overlooked, misunderstood, and serious diseases and helping create a better future for people who urgently need relief. The healthcare industry is shaped by pioneers, and I'm honored to be in conversation with one of those pioneers today, Hadley Clark, director of the Milken Institute's FasterCures. FasterCures is working to build a healthcare system that is accelerating medical solutions that put patient needs above all else. You entered the world of healthcare at a time of great change in terms of scientific advancement. We've certainly made tremendous medical and scientific progress in the last decade to bring innovations like gene therapies or other new medical technologies to market. But we could also agree there's still a lot of questions that we need to address about equity and access and who will ultimately benefit from these advances. So from your perspective, Hadley, how can we prepare the healthcare system to receive these transformative new treatments?
I think there's two key ways that the healthcare system can prepare for new treatments. The first being anticipating what is needed to implement for those treatments. For example, provider training, education, and awareness. And two, we need to consider what must be done in advance from a policy perspective, like reimbursement and coverage. Coverage plays a critical role in ensuring how and when people have access to these advancements.
I think you're spot on. I think coverage is going to be key. We need to ensure that the reimbursement is there for people who, in order to be able to afford these potentially transformative treatment options, like gene therapy, for example. The traditional payer models where we pay for prescription, they're not going to work here. We need payers to recognize what is the long-term value of gene therapies. We need to adopt new models like those that pay for performance or pay for response, value-based agreements, or even pay over time financial models. And because we know that when it comes to these therapies, cost and coverage, they can be a major barrier to access, but we also know that's not the only roadblock. Hadley, what other hurdles do you think stand in patients' way?
Yes, I agree. Cost can be a major barrier to access, as can be prescribing them in the first place. And I think precision medicine is helping us better predict what medications to prescribe each unique person throughout their treatment journey. And awareness and education to enable providers to acknowledge and better understand patients' needs help remove other barriers to access as well.